Oxyviral nasal spray has been tested by a number of ENT and allergy doctors in New York. I went to a number of ENT allergy doctors in New York and asked them if you can give me opinion and do some basic clinical testing whether this nasal spray is effective as a nasal cleanser. Does it have any benefits? Many doctors refused to do this little study for me, but a number of doctors agreed to do this study for the benefits of the advancement of science and as a benefit to the patients. They did not ask for any money. I had the opportunity to talk to Dr. Larry Shemen. He's an ENT surgeon located in Forest Hills as well as Manhattan, New York. He's a very qualified doctor. He's a very cheerful guy. He's a very thorough guy, and he's a very specialist. Very complicated cases he deals with, cancers, etc., etc. So he's well known in the field. So I requested him if I could have 5 minutes of his time and if he could do a little testing for me. Very busy office. To get a few minutes of his time is really very significant for me. I explained to him how this nasal spray works. It has a hydrogen peroxide. It's for external use only. It works as a nasal cleanser. So I showed him a video demonstration of the nasal spray. So he was interested. He says a new kind of nasal spray is nothing that like this he has seen ever. So he said, okay, he will do some basic testing. Actually, he used the nasal spray right in front of me. And after 3 minutes of time, he says, wow, it cleared my nose. It decongested my nose. He said, what's in this nasal spray? Does it have neonicefrine in it? So I didn't even know what that is. So he says, just, I told him it's just basic nasal cleanser. And he said, wow, it just cleared my nose, it decongested my nose. So he was very intrigued. And then he wrote this report. And then he says it helps to decongest the nose without neonicefrine. It has no side effects, etc., etc. So he was very impressed. Good to know that he's a very well qualified doctor. He's making this observation and comment. And he did not ask for any money and gave a very honest opinion. I really appreciate his time. So then we talked about further. He say what else this could be used for. He deals with the cancer patient in many of complex situations. So I gave him some more samples. He say he'll think about it. Maybe it has some application. So he called me back after a few weeks. He says you need to come to the office. I was a little concerned. I said, maybe something, could have gone wrong or something. So I went back to his office. He explained to me on a chart where it shows like a throat diagram, nasal diagram, etc., mucous membranes. And he said he's dealing with some cancer patient, a nasopharyngeal carcinoma, which is a cancer in the back of your nose, make you breathe difficult. It narrows the passage, and he says going through a treatment, a radiation treatment called radiation-induced fibrosis. So the patient has difficulty breathing, and he said he tried this nasal spray on the patient, and it immediately made him breathe easier. And he said it's really it's a breakthrough. You need to find a way to make this nasal spray available to the patients, and I can help you any way I can. So he called me back one time. He said, we need this nasal spray samples right away. We have difficulty, patient has difficulty breathing. One time I had to rush back this sample to his office. Then he put me in touch with the patient herself. And the patient called me back a week later, and he said how this nasal spray works, how to use it, etc., etc. He says, and she says she tried all kinds of nasal spray in the market, whether it's Vicsinex, Ephraim, etc., etc. Nothing really worked except this one. He said, what's in this nasal spray that makes me breathe easier? So I told her it's not a drug. It's basically a nasal cleanser. Your nasal passage perhaps is narrowed out due to the something developed in your back of your nose, and that a little bit of mucus will narrow down your passage of breathing, and then this nasal spray basically clears that mucus and makes you feel breathe easier. And she was very impressed. She said she's going to keep it in her pocket, in her purse all the time. It's a very, very significant breakthrough that Dr. Shemen is responsible for. And we agreed to collaborate on other nasal sprays that within the pipeline, for example, a throat spray, ear spray, etc. So he's a specialist in the field, and he has an instinct of finding new things, new invention, very complex cases he deals with, and he's willing to help the patient any way he can. So for the advancement of the science and to help the patient, that Dr. Shemen is really expert in the field, and I appreciate his dedication and his time. He has not asked for any money, and he's willing to help any way he can, and he's really a star in my view. And I thank you, Dr. Shemen. I appreciate your time.